Now we're going to check the two areas where it's most common for that to get caught up. So lay down on your side. Scoot down here. So I'm going to get you over here. So first area where it gets caught up in that sciatic nerve where it goes through is down right against the superior gemellus. You know, a lot of people think it's piriformis, they think it's something else, or the glute. It's not. That sciatic nerve is in full contact with that superior gemellus, and it's a perfect point where people sit so that nerve can get stuck there, and that can create a limited test, can create pain down the leg, tight hamstrings, everything like that. So what I like to do is I like to palpate it with just a little bit of relaxed in there. And this one, you got to use your landmarks to find it. One place we go first is greater trochanter, and we can find that. Anyone can find that. And then we come off to the side here, and this is the back part of the trochanter. Next thing I'm going to do is I'm going to pick up my thumb and fall into that space, and you can see how I can really sink in on that. This is getting on those external rotators. I'll spin my thumb around just a little bit, like that, and now I want to see how that nerve is bowing and how it's moving. When the nerve is stuck, it won't bow. So what I'm able to do is sink in, and then the sciatic nerve is actually running right through here, so I'll go in there and I'll see how it's moving. And that one's pretty good. I'll pick my thumb up, go here, and that's where it starts to get jammed up a little bit more. Pick it up again, and right there is where it's really jammed up. And that's right on that superior gemellus, right where those external rotators are, and that nerve gets caught here. So a lot of people with tight hamstrings, pain in the calf, even numbness or tingling, a lot of times it's coming from here, and all the tension is in here, and it's not allowing that nerve to slacken. This is about 80% of where entrapments occur in the external rotators in the hip, especially with sciatica-like symptoms. Now, it can also get caught down in the hamstring. So go face down for me. Now, the hamstrings aren't as common, but they can cause problems in there as well. A lot of times when you clean up back through here, it can cause problems in here. So the way I like to palpate this one is just like this. Come in for me a bit. And then essentially what we want to do is see how the sciatic nerve is bowing from each side. So out here we have biceps femoris and the long and short head. In here we have semitendinosus, semimembranosus. And essentially what happens is sciatic nerve comes down through here. And then what I like to do is start right down here where they separate and go through here and work my way up. And then once I get to an area that isn't compressing, I do that bowing just like we did as we go through here. And I'm seeing where it's getting caught up, where it's not moving how it should, and I'll also try to bow that nerve lateral. So once I identify the area where it's stuck and not moving with scar tissue and adhesion, then you get in there and apply your treatment technique, and you want to get depth and tension on that as well. So the sciatic nerve function test and straight leg raise can give us a lot of information about what's going on. The key that you always want to be able to do is you got to dial in with the patient. Ask them what they're feeling, what type of symptoms they have, and really figure that out, and trust your palpation as you go down. You know, you want to start in the hip and work your way down and get that nerve to free up, because if the nerve frees up, it really gets things functioning better. So in a healthy straight leg raise, the patient should be able to bring it right up to 90 degrees, not feel any tension in the back, not feel anything from there, and no change when you pull that foot down. So this is a great test, especially for those stubborn hamstring problems, sciatica problems that aren't cleaning up, and even low back problems as well. Can really get in there and dial in what's going on with a better palpation, better test. You can show the results that the patients need to see. Now we're going to get into the sciatic nerve treatment. The client position is very important. You want them to be stacked up to the edge of the table, have that shin tucked nice and parallel, and then essentially what we're going to do is bring this leg over nice and straight, because it's going to create tension on that nerve, and it's going to sit right against the table. Now the motion for the client is they're going to start, once we apply depth and tension, they're going to start by moving their leg just like that. They're going to reach behind with the hand and pull it just like that. And that's going to create that motion and that tension. Now the key is getting on that and finding the palpation. You've watched the video, now you know where to go. Now the key here is your body position where you line up. So once you're in here and you find the area, you have the trochanter, you have the back of the trochanter, and then you sink into that space. This space up here is hip capsule. This back here is sciatic nerve. Once you find that, your hand is going to be nice and flat. See how that's flat in there? You don't want to be tented, you don't want to be grabby with that. Then the next thing you're gonna do is you're gonna back that up with that opposite thumb. What you're gonna do next is back that up with the opposite part here. That's gonna help you get your depth. So once you find that area, what you're going to do is you're gonna be right over top of it. Your thumb is gonna be in just like that. You wanna be up on your toes, arms nice and straight, and you're gonna lean in just like that. And then you're gonna get some more depth by pushing with this opposite arm. And then your tension is gonna be that slow body lean. And then the client is gonna start to go through that motion and start to move that. And you're just gonna keep your sternum right over the top. And sometimes when they're really having some trouble moving that, you're gonna sink in, push in like that, tension, go ahead. And you might have a client that has some trouble with that. What you're gonna do is readjust, and you're gonna get the rest of that motion in there to open up, just like that. Now the key here is your mechanics and your body position. So you wanna be up on your toes, and you wanna have your arms nice and straight, and you're gonna sink in just like that. Your depth is gonna be that push here, and your tension is going to be that lean away. And what you'll see is when you're doing that, you're gonna kinda pivot on your feet and pivot on your toes. That's gonna help you keep your sternum over top. Because if you keep your sternum over top, it's gonna allow you to keep the right vector and make that a more effective treatment as well. So the key is setting up just like we've shown you in the warm-up. You're gonna set up in through here, on your toes just like that, sink in, press, tension, go ahead. Client moves, and sometimes you gotta give a little extra help, and it's gonna be a gentle, you're not gonna force it. You're gonna take it just past parallel of the hip here, and you're gonna go nice and slow, because if you're too quick, it's not gonna feel great for the client. It's gonna pull that nerve really tight, and you're not gonna get an effective treatment.